All right, so BSI, scene safety for my crew and myself. I've got dispatch information that says this is a 67-year-old male with chest pain, difficulty breathing. So that's my nature of illness. I've got one patient for the dispatch notes. There's no environmental hazards. There's no need for C-spine because, again, this is nature of illness. And then we're going to go ahead and form our general impression. So 67-year-old male, clutching his chest, clutching her chest. Appears to be in mild to moderate to distress. So walk up to the patient. Hi there, my name's Kyle. What's your name?
Naya.
Naya. How old are you? 67?
67.
Great. What's going on today?
My chest just, it really hurts. It's,
Okay.
I don't. Severe
Really bad chest pain? Okay,
Yeah.
fair enough. You know what city you're in right now?
Santine,
And you know what year it is?
2025.
Okay, so Naya, 67 years old, chest pain, shortness of breath is the chief complaint. A&O times 4, answering all questions appropriately. Naya's talking to me, so airway's patent and maintainable. Naya's breathing a little labored, probably about 30 to 40 times a minute, shallow, and again, labored. So we're gonna go ahead and address that breathing issue as we found it. So Naya, just to explain to you, you're having some difficulty breathing. We're gonna go ahead and put you on some supplemental oxygen. So we've got our oxygen cylinder here. We'll go ahead and crank it up to 15 liters per minute. Plug it into our O2 mask here. This is a non-rebreather mask. We're gonna go ahead and place our finger over the mask so that it inflates, and then we'll apply it to our patient. All right, Naya, so just take some deep breaths in for me. This will allow you to breathe a little bit better. It's just full 100% oxygen. Moving down into C for ABCs. Naya's skin's pale blue diaphoretic. Radial pulse feels weak and thready, and there's no obvious signs of bleeding. Proctor confirms that's what's going on. And then this is a priority patient, so we're gonna start transport immediately. Moving into my next line of questioning, this is at the point where the patient's gonna go ahead and have a condition change. So Naya, when did this chest pain start? No response. So Naya, no response to verbal. Naya, no response to verbal. Okay. Sternal rub, trap pinch, painful stimuli, no response. Okay. Naya's unresponsive, so we're gonna go ahead and take the oxygen off and safely lay her on the ground. At this point, we're gonna look, listen, and feel. So I'm feeling for a carotid pulse, I'm listening to airway sounds, and I'm looking at the chest for rise and fall. I hear gurgling, I have a carotid pulse, and I don't see any chest rise or fall. So we're gonna go ahead and look in the airway. There's a bunch of vomit. Let's turn our suction unit on. We're gonna test suction on our hand before, and then we're gonna enter without suction, only as deep as I can see. Apply suction on the way out in circular motions, no longer than 15 seconds. Recheck the airway. Airway is now clear. Hand me that airway back, please. We're gonna go ahead and maintain our patient's airway for them since they aren't doing it themselves. This is an OPA, so measure from the corner of the mouth to the angle of the jaw. Insert, and then turn 180 degrees so that it fits properly. Get our BBM, unplug our non-rebreather mask, and plug it into the BBM. And then CE grip to be able to get this patient breathing again. So we're gonna go every 5 to 6 seconds, or 10 to 12 times per minute, one breath. 6. All right, 2 minutes that's gonna go by. We're gonna reassess our patient. So now, same way we did before, looking at the chest rise and fall, feeling for carotid, listening for airway sounds. I now have no airway sounds, no chest rise and fall, and no carotid pulse. Partner, go ahead and grab the AED off the desk. I'll start high quality CPR immediately. Telling my proctor I'm going at least 100, no more than 120 beats per minute. Go ahead and just put it down at the head.
Okay.
And then unplug it for me.
Unplug it? Okay.
Again, 100 to 120 beats per minute. You don't have to put it on, I'll do it all.
Okay.
I'm just talking through it. So 100 to 120 beats per minute, ensuring full chest recoil in between each compression. And then we're going at least 2 inches, or a third of the diameter of the chest. This is a 30 to 2 compression to ventilation ratio, so 28, 29, 30.
That one just does not want to
Yeah,
work.
it just falls off. 1, 2, and then back at it. 4, 5, 6, 7, 8, 28, 29, 30. All right, partner gets back with AED. I'll go ahead and swap with you, so go ahead and come on this side. And then you're gonna take over in 1, 2, 3. And now my functionality is to work the AED. Step 1 is to turn it on.
Apply pads to patient's bare
And
chest.
then listen to the prompts.
Plug in pads connector next to
Pads
flashing
go on the
light.
chest.
Analyzing heart rhythm. Do not touch the patient.
Okay, freeze.
Shock advised.
Back on the chest. You don't have to worry about the ventilation.
Charging.
Go ahead and do compressions.
Stay clear.
I'm gonna start this over
patient.
for the video just so just do
Apply
hands only
pads.
CPR and then we'll talk through it. So step 1, turn it on. Step 2, apply the pads.
Apply pads to patient's bare
Step
chest.
3, plug it in.
Analyzing heart rhythm.
Once it says do not touch the patient,
Do not touch the
Hover.
patient.
shock advised, back on.
Shock advised.
And
Charging.
then I'll let you know when to stop again.
Stay clear of patient.
Stop.
Nope, keep going.
Deliver shock
Alright,
now.
and now you're clear,
Press the
I'm clear,
orange button.
shocking,
Shock
immediately back on.
delivered.
We want to minimize the time off the
Begin
chest.
CPR.
And now my role as the person operating the AED is to get back on the BVM, and we're doing 30 to 2. So just let me know when you get back to 30 compressions.
9.
Okay, 1, 2, and then back in, 30 to 2. And then you would just tell your proctor every 5 cycles of CPR, every 2 minutes, we're gonna rotate compressors. 28, 29, 30. Back on. And that's it. Cool. That's how it goes, start to finish.